results are effective and just so quick. Hey everyone, welcome back to my channel. This is Dr. Duong, and today we're going to talk about dry needling. This, along with cupping, is one of my absolutely favorite tools to use because the effectiveness and the quickness of the results that I see in my patients are truly astounding, and I absolutely love it. My patients love it too, because then they can rehab quicker or they can recover way quicker than with other tools. If you haven't heard of dry needling before, it is actually gaining so much popularity in the physical therapy realm, but also with chiropractors. How dry needling works is we're using a really thin needle to penetrate either the muscle, get to the ligament, capsule, whichever region we're working on, to stimulate healing. So what that needle is doing is it's causing a little bit of micro trauma so that it can tell your body like, hey, this area needs a little bit of extra healing. Send in the repair team, send in that inflammatory team that helps repair and rebuild the muscles and that area. Now, we have a lot of different techniques that we can use called winding, fanning. We have periosteal pecking to stimulate extra healing. We can add electrical stimulation to do similar things, but ideally, the basic concept of it is we're almost doing like a Control-Alt-Delete reset for the muscle. Now, you may be asking, is it the same as acupuncture? No, it's not. It's actually based off of more westernized theories and principles. So if you're interested in learning about the difference between dry needling and acupuncture, let me know in the comments below and I'll make another video for that. But as far as dry needling goes, it helps to release a lot of muscle tightness and helps with pain, inflammation, increasing blood flow, and helps to increase range of motion. While there are many benefits to dry needling, let's also talk about the cons. One of the cons of dry needling is sometimes it can cause a little bit of minor bruising. This is because as we're getting to the muscles, sometimes we may get a small vein and then we might get a little bit of blood afterwards, but it's usually not anything major and can heal up pretty quickly. The other con would be that if we get some really good spots, we get some good twitches, then you might feel sore for the next day or two. Now, if you are feeling sore for longer than 2 days after your dry needling session, then that means the therapist did a little bit too much as far as dosage and you want to pull it back a little bit. Lastly, let's talk about the contraindications. So this is when you shouldn't get dry needling done at all. First and foremost, I'd highly recommend you chat with your healthcare provider to see if it's a good option for you in your case, because it really depends for every person and every condition and scenario that we're working with, right? You want to treat the individual, not the diagnosis. So talk to your healthcare provider first. One of the contraindications is if you are on blood thinners, then we absolutely do not dry needle you. I'll tend to use more hands-on manual therapy work for my patients instead to help them with their pain. If you are scared of needles, then I also do not recommend dry needling. I'll tend to go towards cupping or other hands-on modalities to help with my patients. To wrap up everything, dry needling is a super beneficial tool to use to help with any pain, conditions, injuries that you're experiencing, but make sure you are contacting your healthcare provider to see if it is a good fit for you and your specific symptoms. We scratch the surface with dry needling. There's definitely a lot more that we can talk about. So if you have any other questions, feel free to leave it down in the comments below, and I can always make another Q&A video for those questions. If you enjoyed this video, then make sure to hit that like button, hit subscribe, and I'll see you in the next video. Bye.